Bismillahir Rahmanir Rahim. Welcome again, guys. Welcome back to another video lecture by Kami Microbiologist. So we have started the series of videos lecture that is regarded to the blood film. So in the blood film we talked about the introductory portion of the blood film, that what is a blood film or blood smear or peripheral blood smear. We talked about this in the introductory portion. It is present into my channel, you can go back and watch. And then in the second video we talked about the N-isocytosis, in which we talked the RBC structure, each and everything. So it is also present into my channel. Now this is the third video lecture that is also regarded to the blood smear or peripheral blood smear. So in this video lecture we are going to see the RBC color, means variation in RBC color. So first of all, let's start with the introduction that RBC color is due to the presence of hemoglobin. So hemoglobin is actually the protein, or we can say it is the color pigment that is present into the RBC, and due to this way the RBC are look like in red in color. Now the third point, the second point says that remember, when the RBC have HB, means when the normal RBC have normal hemoglobin. So when you see the RBC into a microscopic field, so it will be look like in red color or in orange color, and they have light white color in the middle portion, and this white light color will be 3 micron in diameter. So if I show you the picture, this is the picture. As you can see, this is the microscopic field, and in this microscopic field you can also see that the RBC color, which is red in color, and they have white middle white color, light white color in the middle, and it is about 3 micron. Moreover, the RBC remember one very important terminology that we have to know about the normochromic RBC. When you see in the field that there is a normal RBC and they have normal color, so when then we call that normochromic RBC. This is really important. Normochromic RBC means normal RBC color. Normo means normal, chromic means color. So when the RBC have a normal color or red in color, orange in color, just look like in this form, if you see in the field, this is called normochromic RBC. Now let's talk about the hyperchromic RBC or hyperchromia. So hyperchromic, as the name indicates, hyper means increase or high. So when the RBC have high concentration of HB, obviously when the RBC have high concentration of HB, so the RBC will be look like in a dark red in color. Okay, and it may be also look like a macrocytic or microcytic or spherocytes in form. So hypochromic RBC will be in a microcytic, macrocytic or spherocytes. Macrocytic means a large form of the RBC, micro means small form of the RBC, and spero means circular form of the RBC. The third point says that MCHC and MCH. If you guys remember, I also explained the MCHC, mean cell hemoglobin concentration or hemoglobin corpuscular. Okay, it is present into my channel, you can go back and watch it. So the third point actually says that when the MCH value get high, okay, so when the MCH value get high, so then the cell will be a spherocyte, and when the MCH value is normal, so then the cell will be macrocytic or microcytic. So this is really important point. If you see in the RBC report, if you see MCHC is value is high, and then in the field you will also see the spherocytes, and if you see that MCH value is normal, and then in the microscopic field you will see macrocytic or microcytic RBC. So this is really important. You have to know about this while examining the blood smear. Fourth point says that low central area, means that the RBC have very low central area. So in case of the hypochromic RBC, they have very low central pale area. So if I show you the picture, so this is the picture. As you can see, this is the hyperchromic blood picture, hyperchromic RBC picture. It means, as you can see, that very less pale area is present at the center of the RBC, and the RBC, some of them are the microcytic and some of them are the macrocytic, but it will be depend upon on the value of the MCHC. Okay, you have to notice the value of the MCHC, then you will be easily understand that either it is saprocytes, macrocyte or microcytes. Next we have hypochromic RBC or hypochromasia. What does it mean? It means hypo means low, chromic means color, RBC means red blood cell. So when the RBC color are low, this is called hypochromic. So it means that HB level, we better know HB provide red color to the RBC. So when the HB concentration are get low, then it is called as a hypochromic RBC or hypochromic RBC picture, we can say like that. And one thing more, that how you will find that it is hypochromia. So you have to know about the MCHC and MCH. I also explain the MCH, mean cell hemoglobin. I also explain this. Okay, you have to know about these two value. When these two value are get low, so then this condition is called as hypochromia. Okay, next is high central pale area, means that when you see the hypochromia RBC, so there the RBC in this case will be, they have very high central pale area. Let me show. As you can see, this is the hypochromic condition. So this is the hypochromic, this is the normal RBC, this is the hypochromic RBC, mean they have a very large, this pale area. And this is the severe hypochromia. This we can say there's 2 plus or 3 plus. This is the 3 plus, this is the 2 plus. If we want to rate to the RBC, so this will be the 2 plus and this will be the 3 plus. This is really important. Okay, now this is another slide. Now this is the microscopic slide. If you see in under the microscope, if you see this condition under the microscope, so this is called as hypochromic condition, hypochromic blood picture. Okay, let's explain some condition of the hypochromia, that in which condition the hypochromia will be present. So in case of the Wilson disease, in case of the immunohemolysis, thermal injury, hereditary seprocytosis, Clostridium bacteria, microagenopathic hemolytic anemia, vitamin B12 and folic acid deficiency, we have hypothyroidism, alcoholism, chronic liver disease, myelodysplastic syndrome. So these are the main important condition in which hyperchromia may happen. Then we have the condition of hypochromia. So this is about hyperchromia, and now then we have the condition of hypochromia. So hypochromia will be due to the congenital sideroblastic anemia, anemia due to malignancy or infection, IDA means iron deficiency anemia. Next we have hyperthyroidism, thalassemia, lead poisoning. So these are the main conditions due to which hypochromia will be happen. Another variation of the color in the RBC, that is called as polychromasia. What is polychromasia? When the RBC are bluish in color, we call it polychromasia. And this bluish color RBC are also called as reticulocyte, which I already explained. It's also present into my channel. Okay, reticulocyte means immature RBC. And let's explain the condition of polychromasia. So it will be happen the person who are, or the people that are living at a high altitude area, due to the hemorrhage, due to hemolytic anemia, due to radiotherapy. So this is the blood picture, or this is the slide. When you see this type of the RBC, this is called as polychromasia. Okay, in the next video we will explain poikilocytosis. I hope this video is helpful for you. Thank you so much for watching.